We are all affected by health literacy. You, your parents, your neighbors, the children in the schools, and your wider community. Health literacy is closely linked to literacy and includes people's knowledge, motivation, and competencies to access, understand, appraise, and apply health information to promote their health and the health of those they love in their communities. It is relevant for making decisions in everyday life in terms of healthcare, disease prevention, and health promotion. To be health literate, one must possess the reading, listening, reasoning, and problem-solving skills necessary to make informed choices about healthcare and health. Health literacy is essential for maintaining and improving quality of life during the life course. However, research shows that people with limited health literacy have a hard time comprehending health information. For example, understanding and utilizing appointment slips, medication labels, vaccination guidelines, health educational material, insurance applications, and general health information provided by health professionals, the media, or the internet. The European Health Literacy Project took place from 2009 to 2012, with financial support from the European Commission. The core of the project was the European Health Literacy Survey, which took place in 8 European countries: Austria, Bulgaria, Germany, Greece, Ireland, the Netherlands, Poland, and Spain. By interviewing 1,000 people in each country and hence creating a data pool with 8,000 people in total, it was possible to generate first-time comparative data on health literacy in Europe. Based on the analysis of the data, it is possible to determine whether a person has an inadequate, problematic, sufficient, or excellent health literacy. People with either inadequate or problematic health literacy are likely to face considerable barriers in making decisions concerning healthcare, disease prevention, and health promotion. What can the European Health Literacy Survey teach us? Firstly, the survey indicates that health literacy is closely related to self-perceived health. People who believe they have bad health tend to have poorer health literacy than people who rate themselves as being in good health. Secondly, the survey also shows that the health context matters in terms of people's health literacy. In the healthcare setting, an average of 40% of people faces difficulties. This can be understanding what the doctor says or knowing what to do in an emergency. In terms of disease prevention, an average of 42% of people has difficulties, like judging which health screenings to obtain or deciding on a flu vaccination. An average of 49% of people faces difficulties with decisions related to health promotion, such as understanding information on food packaging or finding out about how political changes may affect their health. Thirdly, the survey highlights that the levels of health literacy vary significantly across countries. The Dutch appear to face the fewest difficulties. Only 29% on average have limited health literacy. In contrast, more than 50% of people in Austria and Spain have an inadequate to problematic health literacy, and in Bulgaria it is more than 60%. Lastly, the European Health Literacy Study reveals that health literacy is a challenge for almost 1 out of 2 people. 47% on average appear to have either inadequate or problematic health literacy. In addition, the survey shows a strong social gradient which is closely linked to age, education, and socioeconomic status. It means that the risk of limited health literacy is even higher in certain population groups. For example, among people with long-term illness, low education, financial difficulties, or for people who are more than 75 years old. The health literacy challenge is an issue for politicians, healthcare professionals, and citizens across Europe. Concrete actions need to be taken to empower people and qualify professionals and decision makers. The key priorities include decreasing the complexity within healthcare and social systems and making it easier for citizens to navigate them. Supporting initiatives that improve health literacy, particularly amongst the most vulnerable groups affected by limited health literacy. Including the development of health literacy as an essential part of national educational systems and school curricula. Establishing a monitoring system that can follow the European progress on health literacy. By acknowledging the health literacy challenge in Europe made evident by the European Health Literacy Study, we can improve efforts to support professionals and people to become co-managers of health and lead the way to a healthier society. Living a long and healthy life. Health literacy matters. The European Health Literacy Survey.